What are some of the most deadliest diseases and what is it like to die from them? Let's talk about pancreatic cancer. Here are three main symptoms that you'll see with pancreatic cancer: ascites, which causes pain or shortness of breath, confusion, and jaundice. And to be clear, this video is for informational purposes only. Please take all of your questions to your medical provider. You can always learn from this video and take it to your healthcare provider where they can give you medical advice. I've watched hundreds of people die, and from what I've seen shows me that the more you know about the disease you're dying from, the better you'll live and the more peaceful you die. So pancreatic cancer, why is it so deadly? It's because usually by the time doctors find it, it's already advanced and metastasized, meaning moved to a different part of the body, usually the liver. What I'm going to be talking about today is specific to hospice or like advanced pancreatic cancer. When you first get diagnosed, there are things you can work with an oncologist, a radiologist, a surgeon to do things to help extend your life with pancreatic cancer. So just to be clear, today we're talking about when you're end of life or when you're going onto hospice with pancreatic cancer. Depending on your disease process is when you're going to come on hospice. But in general, when you come on hospice with pancreatic cancer, the main symptoms that I see, one is something called ascites. Ascites is basically fluid in your abdomen, and it makes you look like you're 8 months pregnant. So very big fluid buildup. This is because usually from the pancreas, it moves to the liver, and then the liver creates this fluid in your abdomen. There is an easy fix for this. It's something called a Plerex drain that I would recommend you getting placed before you come on hospice. You'll have this little pigtail drain, they call it, in your abdomen, and then you can drain that fluid by yourself at home, which will help control that symptom, which could cause pain or shortness of breath just because it's pushing on your diaphragm. So that's one of the main symptoms I see, but there is an easy fix for it. The second symptom I see is confusion. So confusion happens again because from pancreatic cancer, it usually metastasizes to the liver, which means move to the liver. And when it moves to the liver, and your liver's not functioning well, your ammonia level in your body will start rising, and it'll cause you to be confused. Again, easy fix. There's a drug we call lactulose. Lactulose is like a sugary liquid that you drink and kind of tastes like cough medicine, and that binds to the ammonia and then you poop it out. So side effect of the medication, you poop a lot, but you will become not so confused. So it's great. I love using lactulose with all of my pancreatic cancer patients. It'll really help with the confusion. And then lastly is jaundice. So jaundice just means your skin turns yellow. You usually don't have any symptoms, like nothing happens, but you do look a little yellow and sometimes a little itchy. In general, on hospice, we are experts at managing symptoms. So this is nothing new to us, and we can help you with all of those symptoms. So it's important to know what to expect so you can plan and you can live better and then die better. Tell me what disease information you'd like to hear about next, and don't forget to leave that in the comments. For more death and dying information, don't forget to subscribe to my channel.